Should you panic because of high hematocrit, hemoglobin, red blood cells? Don't really understand the nuance around testosterone, erythrocytosis, and donating blood or not donating blood. So many times, it's so frustrating for us in the industry, they call it polycythemia vera. If your white blood cells are normal, if your platelet count's normal, and you have a slightly high hemoglobin, hematocrit, could be dehydration, could be a little bit of the effect of the testosterone, but overall, it's not something to panic about. You may have an issue with sleep apnea. There's many different pieces to this, sometimes even above. You like to keep the levels below 55 to 54% of hematocrit, but there are other things to take into account. So what would cause some sort of clotting or other issues? Do you need to donate blood or do bloodletting or therapeutic phlebotomy when you're on TRT? Now, you can ask this of the general population as well. There are many different people who do donate blood or do therapeutic phlebotomies who aren't on TRT. Those are people who have hemochromatosis, a genetic disorder that gives them very high levels of ferritin, which is a stored iron in the blood. And we've had guests on the channel before to talk about what ferritin does and why too high levels of ferritin are not good for your health. But in the context of TRT, we know that testosterone treatment, testosterone itself, is very potent at improving your red blood cell count, and as a result, hematocrit and hemoglobin. So what is hematocrit? Hematocrit is actually, they call it the thickness of the blood, but it's actually a calculation that takes into account your red blood cell count plus your mean cell volume. That means the volume of the cell. This could be very deceptive. The calculation doesn't always take into account how quickly the lab has analyzed your blood. So if you have a blood sample that's sitting around for a few days and you're right on the border between having okay hematocrit or erythrocytosis, which is too many red blood cells, hematocrit level will be inflated by the mean cell volume being inflated, and the mean cell volume will be inflated because the blood's been sitting around a bit longer, giving you a larger number for the MCV, usually in the high 90s to 100. When you take that into account and add it to the red blood cell count, now you're going to have an elevated HCT, hematocrit, when your hemoglobin may be normal and your red blood cell is normal. So there's a lot of things to take into account. Look, testosterone therapy, according to some studies, and there's a lot of research that's gone into this, has never been shown to cause stroking or any kind of issue like this in the context of normal therapy. Even when the blood levels get to, sometimes even above, you like to keep the levels below 55 to 54% of hematocrit, but there are other things to take into account. So what would cause some sort of clotting or other issues? Well, you've got white blood cell count. If the white blood cell count is too high, along with the red blood cell count, that's not ideal. If your fibrinogen level is too high, that would also be an indication that your blood could be sticky. But you can't just go on the numbers alone. You have to put it into context, and your doctor has to help you work this out. And most doctors, especially your GP or your primary care doctor, they're going to look at the numbers and just completely freak out and panic and be the first to blame the testosterone for causing this elevation. Now, you can have sleep apnea that you might not have known about or just didn't deal with, and because you have sleep apnea, you're not getting enough oxygen at night. The body is reacting by producing more hemoglobin to carry around the oxygen more easily, and also increasing your red blood cell count. So if you can get on CPAP, this usually helps. It has to be titrated correctly, and it'll give you a better night's sleep. It doesn't always reduce those numbers, but at least you're helping your body not fall asleep, and in the long term, improving your health. So should you donate or give blood on TRT? So my point is, you have to be aware of what your ferritin levels are. And at BMH, we offer blood tests that look at ferritin, as well as serum iron levels, as well as the hematocrit, the hemoglobin, the red blood cells, the white blood cells. We can order you special tests that have fibrinogen in, but be aware, we need to have you come into particular labs, and there's only a few sprinkled around the UK that can do it. But all of these are very important to monitor, and we can do that for you, and we do this for you when you're a patient on TRT. If you're just looking to buy a blood test, we also have these available on our website. But the point is, when you monitor, when you do blood draws or phlebotomies, therapeutic phlebotomies, where they take off a good amount of blood, a pint of blood they say, then it's really important to make sure you're not dropping your ferritin too low. It's not that complicated of an issue, but it's one that you need experts at TRT and testosterone to go along with it, because most of the doctors in the medical community don't really understand the nuance around testosterone, erythrocytosis, and donating blood or not donating blood. Not to mention, so many times, it's so frustrating for us in the industry, they call it polycythemia vera. It's a completely wrong and really to be honest, stupid thing to call it when it's not polycythemia vera. Which means, many blood cells. Polycythemia vera has to do with iron depositing around your organs. This is not what happens with testosterone. It's a known fact. It's a good thing because many men who go on testosterone treatment have low levels of hematocrit and hemoglobin. They're actually nearly anemic. So it's a good thing that when testosterone is added, it increases your production of red blood cells through what's called, increases this thing called erythropoiesis, which then helps with the making of red blood cells. So put everyone's mind at ease. Testosterone therapy, when done in a clinic and in a safe way, can help improve your heart health. It can improve your mental health. It can improve your sexual health when everything's in balance. Some men, even when the levels are completely physiological, may be prone to having higher levels of red blood cells, hematocrit, and hemoglobin. Even when everything is normal, they may be dehydrated, meaning you didn't drink enough water. That also affects the way the reading comes out. So if you're dehydrated over several tests, you're doing a blood test, and you're on testosterone, it may also show these numbers being out of range. So again, it's all about how they're interpreted and what other risk factors there are. But generally speaking, if your ferritin is normal, if your fibrinogen is normal, if your white blood cells are normal, if your platelet count's normal, if your red blood cells are even normal, even on the higher end, and you have a slightly high hemoglobin, hematocrit, could be dehydration, could be a little bit of the effect of the testosterone, but overall, it's not something to panic about unless you usually get over the 55 and 54%. And even then, it's important to decide what's happening and why, especially if your testosterone levels are in the normal range and they're not overdoing it. You may have an issue with sleep apnea. There's many different pieces to this. They have to be picked apart by your doctor, and then the appropriate response goes from there. So overall, testosterone therapy is known to increase red blood cells, but it's usually in a therapeutic way. If they get too high, most likely this could be brought down with some therapeutic phlebotomy, but you have to be careful that you don't lower the ferritin too much, because then you have other issues. And sometimes you lower the dose so low that it makes no difference because there's an underlying issue with sleep apnea. And there are a few patients, a few outliers that might have a gene that makes them more prone to having higher levels of red blood cells. But in general, it's all how you look at the numbers and the data. And like I said, if the tests are sent out, we have to be careful not to overestimate, analyze these to the point where we think you have something more serious, when in reality the bloods need to be done straight away. So in those cases, we'd recommend you go to one of the labs that are more local and do a test to see what your actual levels are when you're hydrated. So overall, should you panic because of high hematocrit, hemoglobin, red blood cells? It all depends on how those are analyzed. It depends on the individual. It depends if you have sleep apnea, and it depends who your doctor is. So if you want good information about how to read these labs, why not contact us at Balance My Hormones. We also have online doctor service where you can come and talk to one of our doctors, and they can review the labs for you as well. So anyway, for more tips like this, don't forget to follow us on Instagram for further long form content. You can continue to watch us on YouTube, and don't forget to like and subscribe to the channel. We have many different videos. We've had different doctors on the channel talking about this very topic of either ferritin too high, hematocrit, high hemoglobin, how to get it all balanced. And on testosterone treatment, one of the biggest questions we usually get are, why is do I have polycythemia? You don't. The name of it is called erythrocytosis, secondary to testosterone treatment. So again, don't forget to like and subscribe. Until next time, to your health. I'm Mike from Balance My Hormones, signing out.